human, not a cat. You saw that one. The Zoom, it was a court meeting, the Zoom court meeting. Daughter had been playing with her food. With a cat's filter with a cat's face.
Him talking to the cat's face, and the judge is like, "You're a cat, right?" And I'm like, "I ain't a real human, I'm not a cat."
Well, we have done a study, of course, on how much energy it takes to do video versus just audio. Now, individually, one doesn't. They said, a 1 hour meeting, probably 3,000 something. Hour of city, whole day. It's supposed to be 30 fast. So I typically will turn my big mouth, except here.
Yeah.
This is different.
Right. Right. Well, you're the face of it.
Well, Steve's the opposite, he's running like 3 Zoom meetings, just.
Yeah, in order to get them on, like, we gotta get further back. That is one drawback of this system.
Yeah. Yeah, I can't focus the camera, but then I'll probably forget.
So they put one in at the legislature, the House, but of course that was, what they did is they programmed in a button.
Oh, yeah. I have that on here.
Oh, you
Could do that. Yeah, well, I have you and Nicole and the full dais, but I can program everyone in different.
But I don't know if your focus works well on that.
I don't know either. We haven't
Well,
tried.
we'll play with that somewhere in the future.
Right. And wait. We are 2 live and
Good afternoon. It's time for our meeting to start. I'm just looking here at 1, 2, 3, 4, 5, 6. Okay. We do have a quorum present. We will begin our meeting, of course, with the electronic notification of our meeting. Pursuant to Utah Code, West Valley City has determined that this meeting will be held electronically without an anchor location given the ongoing novel coronavirus COVID-19 pandemic. West Valley City has determined the pandemic presents a substantial risk to the health and safety of those who may be present at an anchor location. This meeting will be held electronically. Members of the press and public are invited to view this meeting live on YouTube at www.youtube.com/user/WVCTV. Thank you. We do have 6 council members present. Councilmember Tom Hune has indicated he will be joining us shortly. We have next on our agenda, of course, the typical approval of the minutes. These are March 16th. So a motion on the minutes in a second.
Move for approval of the minutes.
Second.
Okay, it's properly before us. Then without objection, the minutes will be approved. Hearing no objections, the voting was unanimous in favor of approving the minutes. Next on our agenda is to review a proclamation recognizing the month of April 2021 as Child Abuse Prevention Month. And this is one that we have done before, so one of our regular ones. And I think most of what it states there is correct with just a few minor updates. or not necessarily correct. It is correct, but it's the same pretty well as last year. These are fairly consistent over time. Any questions on that?
So Mayor, with the proclamation, we used to read those. What do we do now? Just say that we have a proclamation, or is it still read?
Okay, now we're trying some things, and I need to indicate to Councilman Bueller that I can make out some of what he's saying. Let me try and turn the volume up.
My mic is on.
Okay.
My question was, with we used to read the proclamations. Now, will we read it, or do we just mention that we were making this proclamation? It's been a while since we've done one.
Well, I guess there's two ways to approach that. One is, we do have a copy attached to our agenda, so anyone listening could easily look at the agenda and read it. Certainly not here in our study meeting. We typically don't read that. But next week, no, wait a minute. Next week, is that the fifth
Yeah.
Tuesday? Yeah, okay. So in 2 weeks, we can approach that one of two ways. We could read it, although we have opted a few times, if there is no one here from that organization, then we would not read it. And we could still continue that because it is accessible to everyone. The other thing, my understanding is we might have a brief video related to it. And we may want to, in the future, encourage people that if they would like to say something, they're welcome to do that. A recording or a video, brief one, brief. So we can approach that either way, and the council can decide that. For me, I'm fine not reading it, but I'm certainly
Mayor?
open to feedback. Yes.
Mayor, this is Nicole. I just wanted to note that there will be people from the Family Support Center attending the Zoom meeting for the reading of the proclamation if the council is willing to read it. If not, that's obviously completely okay. But they will be planting the pinwheels in front of City Hall as they have done in the past. And Sam's group will be videoing that, and that will be played that night as well.
Comments?
I would be willing to read it if anybody wants to read it, wants it read.
That will be fine. Since no one spoke up much, either for or against that, we typically have said, okay. So Councilman Christensen, next week we'll have you read that. Let's see, next on our agenda is the public hearing that we will hold for our quarterly budget adjustments. And you've all seen those. There are a number of items there. And so this will be adjustments made for such things as grants, rollovers, and other items approved that need to be added to our budget. This includes items that we may have approved through council meetings, but have not officially been placed into the budget, which a number of them are. And so many of them are familiar. With that then, we'll turn to Mr. Welch to see what comments he has to make on it.
Thank you, Mayor. Appreciate that. You've handled the narrative very well. As you stated, this is the one of our quarterly budget openings, which are required by law so that the governing body, which is the council, can appropriate funds. New monies that have come in, projects that possibly have come up since the original budget was adopted, and grants, things like that. So we have it broken down into 3 different categories. We have rollovers, which are ongoing projects and grants that are coming from last year to this year. And incidentally, it's kind of interesting in this rollover grouping, all of those are actually from the police department. So it's just kind of an interesting note. Then we have a bunch of new grants that have come in, and then we have additional projects that you have seen, I believe, probably most of them, if not all of them, either in some form of discussion or else in a council action. So with that, this is the next budget opening that we'll do that will wrap up our year. Will come up in the first week of June, and then we'll complete our budget actions before the council at that time.
Council members, then any comments? I know I have a couple of questions, but maybe some of you will ask the same ones, so. Well, if not, for a couple reasons. One is just its size is the first item on the other agenda is the City Hall repair replacement projects and the timing and what that relates to. So if you could just add some clarification to that one.
Mayor, I can do that. I'll pick that up.
Okay, thank you.
Thanks. So the council will remember that each year we pick a number of projects out of the priority list from the that's prepared by Public Works that usually represents the most needed or longest delayed, or for whatever reason it's urgent, or maybe there's a good contracting opportunity for particular projects. So that's what this represents, those projects chosen in this year. And they are, as you note on there, the detailed list: the fire panel, which is our alarm system internal to City Hall; HVAC VAVs, which are pieces, once again, of the heating and air conditioning system at City Hall; boiler and pump, same thing; and then entry stairs on the west side of City Hall and the parking lot in City Hall. The mayor had asked me earlier, what's the status and the progress on these so far. I have inquired back to Jake, and I'm waiting for answers from him. I do know the entry stairs and parking lot we have not started yet on. The other three probably are in some state of progress, having started or gotten bid or whatever. I'm just not sure yet. So if you're interested and would like to know, I'm happy to get you updates on those, where they are, as soon as Jake gets them to me, Mayor.
Okay. Any other comments? Not hearing any. Some items I got clarified before, but they're mainly just wording that I wasn't familiar with. Hearing no further comments. Thank you, Mr. Welch.
Thank you.
That was a pretty easy one. With that, then, we go to the next item on our agenda, which is ordinance 21-12. This is to amend our city code regarding parking of vehicles. This change is one that we've discussed before. This is the 5-foot rule, that you can't park closer than 5 feet. Wayne informed me they're not going to make a presentation because it's got a pretty thorough vetting, but you can ask questions. So with that, to the council. Hearing no comments or questions, then we're going to move on. So that we'll take care of that decision next week, as we do with all of these. Next is Resolution 21-44. This is to award a contract to Diggett Excavation for the construction of the Tecumseh Storm Drain Project. And I believe we'll have a little presentation on that. We heard about this before, but Mr. Wilson, go ahead.
Yeah, thank you, Mayor. No real presentation today. This is basically just one of the projects we presented last week in our upcoming projects. It's our Tecumseh Storm Drain Project. We have a subdivision out. It's the Westward Terrace subdivision on the west side of 4800 West. But right now we have a lot of surface drainage that basically just goes and discharges into a vacant field. The purpose of this project is to basically collect that storm water and take it over and connect it to our existing storm drain in 4800 West. So this project, we had our bid opening on March 9th. We had 6 bidders respond to this advertisement, and the lowest bidder that came in was Diggett Excavation LLC. We had not worked with Diggett Excavation. We have vetted them a little bit in the last week or two, calling other cities around us that have used them. Both South Jordan City and Salt Lake County have worked with them in the past year, and actually gave some fairly good remarks about them and working with them. So based upon that vetting process, we do feel comfortable moving forward with Diggett Excavation. So our recommendation would be to award this contract to Diggett Excavation in the amount of $202,513, and to authorize the Public Works Department to spend no more than $225,000, considering change orders that may come up with the project.
All right, thank you. Then council members? Hearing no further questions or comments, we've done enough storm drains that I think we're pretty familiar with them now over the years. A lot of great projects in getting our city up to date. With that then, thank you. We'll move on to the next item on our agenda, which is for the city, resolution 21-45. This is to accept a warranty deed from TR West Valley, a limited liability corporation. With that, any questions on these? Or this one, excuse me. I'm used to there being multiple ones on there. Hearing none, then we'll move forward on that to our communications. These are presentations that we have. We'll begin with the first one, which is Healthy West Valley. And who will be doing this presentation? I often look towards to Council Member Fitisumanu, since he's closely associated with that. Councilman, any comments you want to make before the presentation begins?
Well, thank you, Mayor. Yes, myself and Councilman Don Christensen have been very active with this initiative here in the city since its inception. And tonight, I believe the presentation is an overview just to keep everyone apprised of the excellent, very impactful work and efforts that have been going on by this community-based group. And I believe our project coordinator, Kevin Wynn, proud West Valley resident and all around awesome good guy, will be presenting tonight.
All right. It's yours, Kevin. Go ahead.
Good afternoon, Mayor and Councilman. Thank you, Jake, for the introduction, and very excited and proud to be here as a resident of West Valley, representing our city within this health coalition and abroad in other organizations. Is it okay if I share my screen? I have just a brief presentation. Thumbs up? All right, awesome, thank you. Okay, can I get thumbs up? You can see my screen okay? Yeah, perfect.
Yes.
Right. Thank you. Okay, so for today, I want to talk a bit more about our Healthy West Valley Coalition, just going over how it got started in the first place, what things have we been doing, who are a part of it, and future efforts as a coalition. So the Healthy West Valley is an initiative, community initiative focusing on making West Valley an even healthier and happier place to live, work, and play. And how it first started was when we started looking at health differences. A few of us got together and we started looking at health differences within our county and within our many cities. And one quote that we hear a lot in the world of public health, which I'm involved in, is your zip code can often determine your health more than your genetic code. And we see this within our county in terms of life expectancy. So looking at life expectancy differences, we see that, for example, looking at Salt Lake City foothills in that area, on average, folks who live there live up to 84 and a half years. Whereas moving 4.5 miles south to South Salt Lake, average life expectancy there is 73.2. That's a 4.5 mile distance with over a decade of life expectancy differences. And we see this across the board in a variety of different areas. Generally, areas on the west side of the valley have lower life expectancy differences than areas on the east side of the valley. So then we begin to try to figure out why this is. And it comes down to what's called the social determinants of health. And these are the social drivers that drive health. Upwards of 70% of our overall health outcomes come because of these social drivers. Things like having access to grocery stores, proper nutrition, access to healthcare services, neighborhood and community environments, such as parks, sidewalks, things like that often determine our health a lot more than healthcare itself. Although healthcare is an important part, these social drivers are major determinants of our health. So after looking at these different issues and why we see the life expectancy differences, we began to look at West Valley specific health data. A few of us got together and going off of a couple of different metrics, one of them being the Utah Health Improvement Index, which is an index that was built by the Office of Health Disparities, which is part of the Utah Department of Health. And what they rank is they look at Utah small area, for example, West Valley Center, West Valley West, and West Valley East, and then compare it to overall Utah in itself. And they look at 9 different indicators. Some of the indicators being infant mortality rate, life expectancy, those who don't have healthcare coverage, chronic disease, suicide rate, poor mental health. And what they found was within the city of West Valley, compared to overall Utah, we see some of these health disparities, these health outcomes that are significantly different and disadvantaged compared to other areas within the state of Utah. In West Valley, we see high rates of poor mental health, drug poisoning, healthcare coverage for adults and children, and adults reporting poor or fair general health. Seeing that this is the case, we wanted to look at how can we bring our community leaders together. We have, of course, Jake, who's fantastic, Don, councilman members, City of West Valley on board to come together as part of this coalition to be able to begin looking more into these issues. And organizations across the board wanted to be a part of this coalition. We have many different West Valley City organizations a part of this, from Granite School District to Big Brothers Big Sisters, Exodus, Utah Department of Health, of course, a picture of our awesome councilman there, my hometown, IHC, the U of U came on board. A lot of member organizations who work within the city of West Valley came together to begin to create this initiative we call Healthy West Valley. Our first discussion started in August 2018. And looking at other cities, we see that other cities have already begun doing this same effort or already had these efforts. Healthy Kearns, Healthy Sandy, Healthy West Jordan are example other city coalitions similar to our Healthy Coalition of Healthy West Valley. And we started looking at some more health priorities, and we came together and brought and developed a survey. And this survey, we went out to the communities. We had focus groups where we had community members come together to share their input. And we did this both in English and Spanish. We had these surveys built in multiple languages, Vietnamese, Tongan, Samoan, Spanish, we had Somalis. We had a variety of different languages built that targeted 4 priority topics, including physical activity, infrastructure, access to healthcare and mental health, and causes of mental health. And our goal was to get feedback from residents in West Valley to hear more about issues that they may be experiencing related to these topic areas and what their thoughts are on what we can do as a community to better change some of these metrics and some of these issues that they may be experiencing. So a brief glance over the results. We had 208 responses, and issues identified in terms of the physical health issues are things like obesity, diabetes, high blood pressure, lack of exercise. These are all congruent with what we saw from a statewide database perspective. Looking at mental health, we know that especially now during COVID, mental health issues were already on the rise. But even before then in the city of West Valley, many folks reported anxiety and depression, even thoughts of suicide were there, which was concerning to our group. We also asked the question of, well, what can the West Valley community do to help you be healthier? And residents provided input on possibilities of, improving the fitness center, having more access to green space, possible trails and paths, improving sidewalk conditions, places to bike, having designated bike lanes or more bike safety. In terms of nutrition opportunities, having more availability to healthy food options and education. Education was a big proponent of that. If we look at types of interventions and mentions within the responses of the survey on what our communities would like to see more, they like to see more cost reduction or free services provided from the city or organizations. Things like having more events surrounding health and resources, looking at classes, seminars, and workshops were big on this response list as well. And all things that we as a coalition have been working to do more of. Other specific suggestions including fixing lighting, having more parks, more recreation opportunities, farmers markets here in West Valley, exercise classes, a lot of stuff related to physical activity and outdoor spaces. So we were really happy to see these results because this helps provide guidance for what we can do as a health coalition. So efforts from West Valley, Healthy West Valley Coalition included a suicide prevention training. We hosted a QPR training, which stands for Question, Persuade, Refer. And this is a training that could be done for anybody to help question, persuade, and refer an individual who may be experiencing thoughts of suicide and get them the help that they need. We helped to plan events and coordinate events for My Hometown Project, working with Craig with the West Fest, Spring Fest, and National Night Out events. We also, with this big group and different member organizations, we were able to efficiently and effectively share a lot of information, a lot of community-related information. If one of our organizations within our network had something going on, we were able to disseminate it to all of our other organizations and their respective networks, which was fantastic. And this was really crucial once COVID hit our city, a year ago when COVID pandemic happened. And that's where our shift from some of these health priorities to COVID happened. For the Healthy West Valley Coalition, we worked to disseminate and share information. We shared resources for community members and organizations, things like how to get rental assistance, where to go to get tested, what does COVID-19 mean? What is that? Where do you go to get care for that? We provided information and updates. We participated in a variety of different community educational events related to COVID. We even hosted our own COVID-19 vaccine webinars in conjunction and partnership with some of our community and state and county organizations who are part of the Healthy West Valley Coalition. We had Dr. Ferguson from Health Choice and Dr. Rodriguez from the U come and present on the vaccine, what the vaccine is, where to go get tested, and help debunk a lot of the myths and barriers that we see within our communities. These two vaccine webinars one was presented in English, another one was in full Spanish, and it was shared on over 40 different networks. We had the mayor of Salt Lake City sharing it, the county mayor sharing it, county health department. It was posted on a variety of different community pages. And overall, we got a lot of good feedback based on our efforts. And of course, we assisted in the promotion of the COVID-19 vaccine clinics that are here in the city. For example, the most recent one that was done on March 13th and 14th. Future efforts for us as COVID hopefully dies down and as we pick up pace again in focusing on other priorities is continuation of webinars, focusing on perhaps mental health or other health related issues, continuing to provide COVID-19 information to our networks and our communities, help support other events which are currently being planned here within the city. Of course, networking and growing as a coalition, we want to encourage other community members and other organizations to come aboard and be able to participate and share their expertise. And then coming back around to really focus on the social determinants of health. How can we improve better access to nutritional food, provide education, improve education within schools, What about physical environments, things related to the social determinants of health? And by doing these different things, hopefully we honor our commitment as a coalition to make West Valley an even healthier, happier place to live, work, and play. And that's what I wanted to present today. I don't know if we have time for questions or if anyone has any comments. I'd love to share more on what we've been doing or answer any questions.
Well, we'll bring it to the council and see if there are any specific questions.
Kevin, in our meeting yesterday, you discussed the possibility of coming under the city umbrella a little bit more. Would you like to present that idea or flesh it out a little bit?
Yes, and this conversation got brought up due to myself meeting with other city health coalitions to see how we can better collaborate with other cities in terms of what they have for healthy city coalitions. And some of the other healthy soil coalitions are actually committees as part of the city. And by being a committee as part of the city, they're able to access things like funding or applying for grants. And some thoughts that I had from my work working in the public health sector at the Utah Department of Health and working with other community organizations is there's been a lot of grants and funding that have been released for coalitions, for cities, for departments that are working to address health-related issues like some that we discussed. And I thought that perhaps if we become a committee, we can have, apply for some of these grants, get access to funding where we can really exponentially elevate the work that we're already doing and be able to make a real impact in these health issues that were identified within our survey.
Just a question, when you talk about those social factors, obviously, from a city standpoint, we have limited resources.
Mm-hmm.
And of those, have you assigned anything to those to say, for example, you could take one of those items and I don't know, would it be mental health where, it will take millions of dollars to kind of move the needle on that. Maybe some of the others where we have a little more control, maybe green space, parks, we can do it for less, but would it move the needle at all? Which of those should a city focus on to try and make a difference? Where can we have an influence with limited resources on an issue that cities can control? Have you done any work in that area?
Yeah, that's a fantastic question. And when we're looking at the social determinants of health in these areas, you're absolutely right. These are very extremely complex and multifaceted issues. But I think looking at issues that the city is already working to solve, for example, improving better sidewalks and lighting. We know that in terms of getting physically active, the biggest determinant of those to get physically active is feeling safe. And to feel safe, of course, we need proper sidewalks, we need proper crosswalks, more lighting in these different areas. And by having those different things that increase safety, we then in turn increase physical activity, which we know is a major proponent of preventing not only chronic conditions, but addressing mental health, providing a place for people to connect to. And this can be done possibly even starting looking at our parks. Maybe if we can improve our parks or promote our parks a little bit more, or how can we build maybe better sidewalks within neighborhoods, maybe smaller parks within neighborhoods. These are some things that I can think of from the top of my head. Looking at mental health, you're absolutely right that it will cost a lot of money to do. But basic things we can start looking at is perhaps promoting more of the mental health programs and therapists that we have here within the city. Maybe partnering with some community-based organizations that address mental health and partnering with them as the city to be able to, spread the message or do, group therapy sessions, things like that. There's a variety of different things that can be done. And I really appreciate that question and also appreciate the commitment that West Valley has made, because that is really honestly the first step, is recognizing that some of these issues exist and then asking the question of what can we do about it.
Thank you. Council, any other questions? All right, hearing none. Nice presentation, certainly food for thought. I know Jake and Don, and I didn't mean to overlook Don, but Jake kind of has a reputation, I guess, with health issues for some reason, kind of like Don and his education background.
Jake and I try to share the front page of newspapers every now and then too.
Yeah. All right.
Yes, thank you all. And no questions from me. I just wanted to add that we'd be remiss if we didn't appreciate, and I think that Kevin did mention maybe once or twice there as well, but our city staff has been phenomenal in really helping us build capacity and sharing great ideas. Craig Thomas in Neighborhood Services and Parks and Rec, Nancy Day, Jamie Young, Parker, and Sam, his team even helped us out design that logo with communications and that. So thank you to everyone who's I think the discussion about which has been mentioned was just brought up yesterday. It's still a new topic, but the question of whether or not or if it's possible to have Healthy West Valley Initiative become a city commission or committee like some of the others that we have. I think the level of commitment from the city and the impact that this is having on residents is already showing a great impact and already shows the commitment of the city in that regard. And I'm happy to continue that discussion and see where that goes as well. Thank you.
And I just wanted to add briefly to what Jake was mentioning. After meeting with a lot of the city coalitions, even we had a National Guard person who works with city coalitions across the board from, West Jordan to Sandy to even down south. And his mention was, wow, you actually have city council folks on your city coalition. That's something that I've been trying to work on in other cities for a long time now. And so they were really impressed with the level of commitment from West Valley City in taking part in these health initiatives from our coalition. So huge kudos to everyone. Thank you so much, Mayor and Councilman, for giving me the opportunity to come share more about our coalition, and hopefully we can provide more updates for you all on our initiatives that we've been doing. Thank you.
All right, thank you very much. Next, we go to our second communication, and this will be our Parks Department current and upcoming projects. And, oh, there's finally showing up. Nancy Day is on the line. I'm assuming that she's going to take this presentation.
Yes, thank you, Mayor and council members. I appreciate taking a few minutes of your time to fill you in on some of the projects that we have going on. And I particularly liked the last presentation on Healthy West Valley update, because I find the information very interesting on the survey that they did ties in directly with a lot of the same results that we got out of our needs assessment and communication that I shared with you a few months ago. So there's, some great collaboration opportunities. So I'm going to go ahead and share my screen. All right, so can you all see that okay?
Yes,
all right.
It's up.
Perfect, thank you. So I'm thrilled to have the opportunity to share with you some of the projects that we've got going on. So we'll jump right in. I can get it to, there we go. So the first project that we've got here is a bike park that we're working on out at Centennial Park. This is the final phase for the Centennial Park development. So if you can see my cursor, you can kind of see the pump track over here to the right that's put in. So just to the south of that is our skate park. So 5600 West to the left. So this is a water retention basin that needs to stay as such for runoff and stormwater, those types of things. And so the bike park is designed to go around that so that it still meets the functionality of what it needs. The project is 1.1 million, and the funding is coming from the Community Development Block Grant. So there's no funding coming out of the general fund for this, which is nice. We are going to be starting construction in June, and we hope to have an opening date by the first part of September and do a ribbon cutting for that. And you could see with this a number of the different obstacles and elements of this. You'll note in the pictures that you see to the left that this is an asphalt track. Some of the bike parks that you see out there, some are concrete, not very many because they're so expensive. Others are dirt, but those actually require a lot of maintenance, especially bikers tend to not want to stay off of it when it's wet or raining, and they cause ruts. And for safety reasons, there's a lot of work that has to be done to maintain that. So with the asphalt, it's much better. There's beginning elements through here in the center. The bottom picture to the left, you can see it a little bit. There's like a little tunnel and some loops. That's part of the beginning course. And then around the perimeter, you'll have intermediate as well as advanced elements to that. The other nice thing with this is with the wooden elements that you see here, with the slats, if there's repair work that needs to be done, we can remove individual slats to do that work. So we don't have to replace the entire structure. So it's a lot quicker, a lot easier for our maintenance guys to take care of that. So that's the first project that we are working on. The next one is Westridge Estates. This property is about 5,200 south, 5,700 west. If you went further south, the McDonald's on 5,400 south is right there in the Maverick. So that kind of gives you an idea here. The smaller property to the west, we actually received that in 2007. So we've had that for a while. The larger piece was deeded over to the city in 2017. So now that we have all of that property, we're able to build this park for this neighborhood. It's 1.4 acres, and it's just under 500,000 is the pretty close estimate of what's going to cost on that. We are taking the funding for that from the impact fees that are collected. So we'll begin the public meetings and the design process now. Depending on where we're at with COVID, these public meetings may be virtual, like we've done over the past year, rather than in person, but we are going to be working with the neighbors and talking with them and keeping them posted, involving them in every step of the process. We hope to begin construction of this the end of this calendar year or next spring. So Grasmere Park, this is the property that's on 1,500 west and about 3,900 south. It's 1 acre. This has been being paid for by the community development block grants, and the construction for this will start in June. So you can see a bit of the design. We're working with the landscape architect a little bit more, making sure that everything is set and okay. So there may be a few minor changes, but really this is what you're going to see. We received this property in 2015. Sunset Hills in the Wood Hollow Park area. These are two parcels that are directly adjacent to each other. The parcel to the south is from the Sunset Hills development, and as you can see, the homes have been built there for a while. We actually received that property in 2009. However, we didn't receive the Wood Hollow property that's to the north until 2019. And we really did not want to start, obviously, construction until we had both pieces of property so that we could build the park together. This is just over $1 million. It is just over 3 acres. And we are currently soliciting design bids at the time. And we'll go through the same process as we do with the other parks by having the public meetings, talking to the neighborhoods, and hope to begin construction next spring for this property. This is an element or a park that has been brought up from time to time over the years. This design is not 100% solid, but it's pretty darn close. This is 80 acres, and as you recall, if you can see my cursor down by this structure here, this is where the new park shop is located. So that gives you a little bit of idea on this. This was purchased with stormwater monies, and so this land is designated for stormwater use. But you would see all across the nation actually stormwater parks that are being converted into wetland parks or natural parks for the community. And this is something that we saw in our needs assessment, that a lot of the community really wanted to see more of in our community. And we have in through here a lot of trails. I won't go through all of the different designs, but to suffice it to say, there will be a few changes. Like I said, the school district facility here cannot be on this area of land, so it will be moved over here. So a few minor changes like that. So we may have to phase the, apologize for that. We may have to phase the construction on that. And we're looking at federal funds, maybe some land and water conservation funds. This would be a perfect spot for that. It is pricey, as you can see. We are having some partnerships with the school district. They're interested in being partners with us, as well as conversations we've had with Utah State University and their agricultural department, some of the things they can do there. So this is something we're really excited about. Another really cool element of this is to the north, and you can't see it on here, but it connects with the Crosstown Trail, which connects to the Mountain View Corridor Trail. And then to the south, if you were to come down to the south here, just a little bit to the west is the Sugar Plum Trail, which also connects to the Foxtail. We're really trying to have that connectivity throughout our city with our trail systems. And this will be an amazing amenity for us to have in our city. Another project that's just about done is our Parkway Park upgrade. As you may recall, last year I talked about this a little bit. We were one of only 12 cities in the country to receive this grant to help us get this park upgraded and throw some new elements in there. You can see we've done some artwork on the basketball court. Down here to the right, this is the beginnings of a pollinator garden. We will have educational signage throughout, and especially at this area, so people have a real understanding of the importance of that. And then, of course, our game zone, more trees to help with our tree canopy, a lot of different things going into this park. And so you can plan on a ribbon cutting and opening sometime before the end of May for this park. Some wonderful improvements for this area. And then just real quickly, here are some additional smaller projects I just wanted to point out. City Park, we're doing a restroom renovation right now, so it'll be completed in the next few weeks. And then the Redwood Trailhead Park and the Hillsdale Park, those are the two county parks that we acquired this past year. And we are starting improvements in that, including new signs are literally being built now to put in there, some city park signs. In the next couple of weeks, we'll be working on the irrigation systems and repairs for that. We also have scheduled in the next 2 weeks a company to come out at the Trailhead Park to do a tree audit and take safety measures that need to be taken during that big windstorm last year. It took down some trees, some branches that are some still hanging. We want to be sure it's safe for the public to use. So that will be happening in the next little bit here. And then we have, of course, some volunteer help from Operation My Hometown. So we want to be sure that the trees are taken care of before we get the volunteers out there. So that's happening. The 6200 South Streetscape, this is out by the Mountain View Corridor. There were some issues with that, but it's being worked on and will be completed before the end of this this calendar year. And then the Woodledge Park sign, this is one that's needed some help for a while. And we looked into it, we analyzed it. We are going to be putting in one of our traditional park signs that you see, the newer ones that are out there with concrete on either side and the laser etched sign. That will be put into Woodledge, and that will be completed sometime next month. Well, in May, not next month, almost next month. So there's that. At the Family Fitness Center, a couple things that are happening. You are aware of the outdoor dino dig area. You can kind of see that top picture there, shows a little bit of that. That's kind of the edutainment outdoor play area. We'll be opening that in May. And this picture here is actually the accessible dino table. So you have the larger dino dig, that is the skeleton of the dinosaur. but not everybody can get down on the ground to play with that. So we have a table that will function very much the same manner. If a child is in a wheelchair or has other mobility issues, they'll still be able to participate. And there'll be some climbing elements, stepping stones, other elements out there as well. So we will be sure and let you know on that so that we could do a formal ribbon cutting for that area. The other thing happening at the Family Fitness Center is the energy efficiency project. And I'd like to say that both of these, we've had a lot of assistance from John Rock. And so he's been very helpful with this. And on this energy efficiency project, this is slated to be completed either the end of May or this June. And they anticipate that the fitness center will save about $70,000 in energy use, which is great at many levels. The golf courses, Stonebridge has that new pump station in, and it is just about done. I know it says March 21st, but there were a few things that they needed to really take care of. So it's probably going to be the first week of April. So we're really, really close to getting that done. And then the Ridge, the first floor restrooms haven't been updated at all. And so those are being remodeled. Those will also be done in the next couple of weeks. And we're also putting a new storage area in. For any of you that have done events or been at weddings at the Ridge, it's great, but the groom's room and the bride's room are used as storage areas. So we are building that in-house and taking care of that there. Harmon Senior Recreation Center. So before COVID, we had the Council of Carpenters approach us and say, we want to do something. We want to volunteer and we want to do something. And we want to do something for the seniors. So Zenda showed them the training room and said, we really would like to enlarge this because there's more that we can do and show. And they were really excited, and then COVID hit and they couldn't do it. They're working on it now. So by the end of April, they should be done. And we will not do a formal opening until the senior center itself opens and we have seniors that can enjoy that. We would like to do that, but we would certainly invite all of you to come and be a part of that with us. And then Barry Harmon, who is the son of Pete Harmon, he wanted to see more computers at the Harmon Senior Recreation Center. And so out of his own pocket, not from the foundation, he paid for 3 HP laptops and 1 Mac laptop and a printer to be upstairs that the seniors can check out and use and move around the facility in. And downstairs, we created kind of a little office area. You can see the bottom picture, and there's an HP and a Mac desktop and then a printer down there as well. And so we'll be doing some more training classes and things for the seniors to help with that. And then finally, the last thing that I have on my list here is at the Cultural Center, we're doing some strong reviews of the canal in that area. You're probably aware that there's been some problems with the water. It's not the cleanest water. There's been issues with that, which is why the water feature hasn't worked for a very long time. And there's also problems with it filling up the orchestra pit at the amphitheater, those types of things. So we actually have a landscape architect working on 3 different designs for us to see what we can do to make that a really appealing and attractive amenity down there at the Cultural Celebration Center. And that is all that I have for my presentation. Are there any questions?
Council members?
Just say it's all very exciting. Thank you.
That.
Especially that train room over in the Harmon Center. That, you get more than 1 person in there and you can't turn around.
Yes.
So that'll be
And
great.
It'll be very, very nice. We're excited about that.
Hearing no further comments, why, thank you very much.
Thank you.
Next item on our agenda. We'll have a discussion in just a moment. I need to preface this just with a couple of comments. I need to caution the council. We do not want to put anyone in a position of sharing any personal health information. We need to keep this on a level that just deals with the issues there. And so you know, there are actually 3 of us here in the city offices, the council chambers. We're doing some testing of the systems. And so if you've seen me playing with, I've been testing out some earphones, seeing how those work, and we're trying to get things set for eventually when we come back together. But there are a couple of items. Besides health issues, there's the issue as well. Some individuals in our community, and maybe even in our council, I don't know, and they don't need to share that, may opt to not be vaccinated. They may not get the vaccination. We certainly hope everyone does, but there's no requirement that everyone do it. And so there's no reason to disclose that information here in a public setting for anyone who doesn't wish to do so. But we do have 3 different areas. We have our staff, we have the public, and we have the council that we probably need to talk about. Any particular comments you want to bring up? And then maybe we can suggest a couple of directions to go.
You know, I am in favor of coming back and meeting as a council, and we can talk to each other without having to push a button and speak, you know, without trying to find the unmute button on the screen wherever it disappeared to in the meantime. But I do realize that we still need to keep the social distancing. And I've noticed, you know, from CDC and others that some of that is starting to relax a little bit. So we should keep those mandates that come down to us. But I still think we can, even, you know, if all of us were here, I think we can stay almost 6 feet apart just because of the way the configuration is.
Well, and the CDC has now said 3 feet apart in schools. That came out yesterday. So,
yeah, I'm always good for whatever is good for a school.
I hope they don't get any closer than 6 inches, because I wouldn't be comfortable under any circumstances. But it seems like we closed down and went remote when either we had state or county orders or guidelines to do so. And I would expect that the state or county would give us guidelines as far as getting back together again. And that would be the timeline that I would expect to follow.
I do think we need to pay very close attention to those guidelines, and that those decisions are made by, there are some decisions made by elected officials, but generally speaking, we want to keep a close eye on what is coming from the health industry, the medical doctors and the like, as to what is appropriate and reasonable. For the time being, obviously, we are not meeting. I think I need to probably sign another letter. We do these 1 month at a time to continue to not use an anchor location, especially since, now, wasn't it everyone over 16 could start getting vaccinations now?
Yes.
And that went into effect. It was just, it's either today or just in the next little while.
They're making reservations and appointments for them now. I think all the appointments in April are full from what I heard yesterday on the radio, but they are opening up more. When the over 70 group got to do it, there was only one place we could go. I think now there are 5 or 6 places that the county health department is suggesting they go for these, for 16 and up. And so vaccination will become much more common than it has been in the past.
Yeah, I believe with the appointment process, what we found was it just took some time. And I don't know how much time it will take. Now, I've heard, and I can't, I don't understand it completely, but they talk about, it's not very nice, I don't think, but I've not heard another term to replace it, herd immunity, where you finally get enough of the population to have been vaccinated, have the immunity that you can somewhat start back to your normal routines.
Yeah.
And I don't know when that will occur, but I'm sure they will tell us.
Well,
But it's going to take a while.
They said it's at 95% of the population, so that'll,
I wonder if we'll ever get 95%.
And I've heard 70%, but I know that at the beginning of this, when we did shut down and move remotely, Mr. Pyle was very much aware day by day of everything that was coming down from the government of the county. And Mr. Pyle, maybe you have some insight or some forecast as far as things opening up, or if we're getting any information from upstream.
Absolutely. Yes. Thank you, Steve, and appreciate the chance here. As you guys all know, and you may have looked at the latest weekly COVID update we put out yesterday, we've obviously been in a situation of stabilization over the last month or more after a couple of big outbreaks. And by couple, I mean sort of an indeterminate number, 2, 3, 4 over the last year, right? There was the initial outbreak. There was the one school started. There was the holidays. There were sort of maybe the mini spikes for like spring break or school getting out, that sort of thing. Through all of that, as we now have stabilized again, we're kind of back about where we were in May-ish of last year, meaning about 25 cases a day. And that has sort of stopped going down. So like this past week was the first week that we saw an actual increase in cases in West Valley net, as opposed to a decrease, which is around 240, 250 active cases right now in West Valley. I bring that up just as sort of a baseline knowledge to, okay, well, where do we go from there? And to answer one of the queries Steve met, we really aren't receiving guidance from on high, so to speak, either the state or the county or CDC or the federal government as to when this could end, or when we could go back to whatever quote unquote normal life is again. So I kind of have, and I know many jurisdictions or entities that have this sort of responsibility are kind of thinking along the same lines in terms of how do I prepare for that point? And for me and our organization, the way I've approached this is this: when we have vaccination availability for everybody, which is kind of now, and maybe permission wise, but also the definition of that in my mind would include when there's sufficient vaccine doses out there that everybody could have gotten it if they wanted to. Added to that, a combination of some sort of definition of, are the case levels down? Are they down as far as they're going to go? Are we finally getting guidance from the health authorities, as the mayor sort of described them, that would make us comfortable to go back to some semblance of whatever normal is again? In my mind, I've sort of projected that as being somewhere around end of May. Maybe I'm wrong a little bit before or after that, but that's kind of what I've been seeing. There are really encouraging signals and discouraging signals at the same time. On the encouraging side, just as an example, we're starting to see stats come out there where, for example, vaccinations are not only stopping the disease at a high level, but they're also having better effect in preventing transmission for asymptomatic infections or illnesses than was originally known or thought or hadn't been studied. That's a good sign. On the bad side of that sort of time estimate benchmark, vaccination availability just is not where we want it yet. And we don't really know how soon that's going to ramp up. Jake might know better than I, for example. But I stay in touch with him occasionally. I check other sources, and I'm at my level not seeing that ascend yet. We're doing a lot more than we were initially. We had 140-ish thousand vaccinations administered in the state last week, which was way more than obviously we were seeing at the beginning of January, but it's also actually a little bit down from the week before. So when are we going to start seeing that really escalate? I don't know. But having said all that, that's kind of the time frame I'm looking at. So on a couple of other points that maybe help along that discussion and decision as you as policymakers and council are trying to decide what to do here. From a staff standpoint, we're ready to go right now in terms of the technology for both reopening council meetings. You'll remember that we installed all of that new technology last year. That's all ready to go. We could even do that and do some sort of modification of what normal was in the past, meaning always have video attendance capability, right? So the anchor location would for sure be City Hall and council chamber, but for those council members who want to attend in the short term, weren't comfortable, or in the long term just weren't available, we'd have a whole new definition of what electronic meeting attendance meant. I would like to see that personally. I would like to keep the capability that we've gained over time. Those are probably the two main points I see coming along the line in terms of what do we see out there. So bottom line, succinctly, here we are, middle of March. Maybe it's 2 months-ish. I certainly was wildly wrong the first time around when I thought after initial lockdowns, maybe we'd be back to normal after a couple of months of this. Here we are a year later, but we are seeing encouraging signs. So I would look for that kind of a time frame.
How does the legislature's passing a law that the mask mandate ends April 10th, how does that affect us or our operations? If we are we still able to require employees or public coming into our buildings to wear masks? Are we able to require people to socially distance, or how does this pronouncement affect us?
Yeah, great question. So without prohibition of local control at the state level, we can still control that. And my a little bit of a challenge, I was going to say concern, it's not so much of a concern as it is a challenge, is that we may get some conflicting guidance there, right? We may have the state say no more masks required, and we may have a proclamation or issuance or whatever at the county level saying, yes, they are still mandated. Kind of how I've discussed that with the various departments over time is how is that and the need for operations affecting our individual status and situation, which is a little different from, say, city administration and City Hall to parks at the fitness center to Mr. Bruder at the Maverick Center. So the short answer to that question is we really see, and as long as we're given the ability from a flexibility standpoint to administer that, we'll be a little, maybe a little bit stronger or a little bit more lenient than whatever the county or state says based on what we see as being our needs at those individual department levels.
I know that businesses that want to protect their employees and require masks are concerned that the public's going to be coming out saying, hey, you can't tell us to do this anymore. And I think we might find ourselves in the same boat with some individuals that have been upset with a mandate from the beginning.
Yeah, agreed. We may very well run into that.
I have a question. What is our liability if we have citizens come in to the seats and actually come to the pulpit and talk, and then they get COVID when they're there because somebody else, even though they're wearing a mask or whatever? I mean, are we setting ourselves up for letting the public in, or is that not a concern?
So just a straight answer to the first part of the question, the liability at this point is really pretty much undefined. You may have noted that during this whole COVID relief legislation discussion, or even over the last year, legal liability to businesses has been an object of great debate. I think we fall sort of in that same realm. So the honest answer there is we don't know. How much that influences you as the policymakers' decision as to when and how to open up really then is up to you. I don't think we really have a whole lot of guidance there for you. It's just kind of more where you guys balance the scales of risk management, right? Risk management is not risk elimination, it's risk mitigation, meaning how much risk are we willing to accept for a particular gain? And that's kind of the policy decision you guys face.
Well, and it's a point of reasonableness. If we are, pushing to open up first and be the first one and bring everybody back and don't worry about it, I think that, we may have some liability if we're proven wrong. But if we're in lockstep with the county and with other cities and following the recommendations, I think that we are certainly acting reasonably and our liability would be minimal.
So is it your intention to come back to meetings with or without masks? Because the 3-foot spacing is if both parties are wearing a mask. They're saying it's safe to be within 3 feet.
I think all of us that are here at City Hall today all have a mask with us. We just haven't worn it during the meeting. And, thinking of people coming up to the podium and speaking to us, we assign one of our staff as what I like to call the pulpit Zamboni driver, who goes up after every person and cleans off the Zamboni, cleans off the pulpit with a sterile cloth. Just like they renew the ice at the ice rink with the Zamboni. So we could do something like that to help mitigate the risk too.
Well, a number of ideas have been brought up here. Clearly, there are a lot of issues. And personally, and I shared this with Mr. Pyle, I'm certainly going to look to staff to give us guidance because they're dealing with it daily. They're monitoring all of this. They're studying issues that come out. I would also certainly nod my head to Councilman Fitissimanu, who deals with this in his full-time professional job, that we can gather information from him. But I would hope he would interact directly with our staff. If he talks to me, I can nod my head and I can maybe catch some of the ideas, but I would not be able to evaluate it nearly as well as our staff. So, and as we see, there are many issues here. There's what's currently acceptable in our broader society, issues regarding masks, issues regarding liability, issues regarding, the vaccinations. If we get a lot of people in here, what role will it? Does it make much difference? From what I understand, a lot depends upon the ventilation inside. And if you're in the right ventilation spot, you don't even need a mask. But if you're in the wrong spot, it doesn't matter with the ventilation. You have to have a mask and you're still perhaps even more likely to get infected there. There are a lot of issues. So personally, I think we can rely on our staff. I certainly plan on doing that. But even when we arrive at the point that we come back to our city chambers as the anchor location, every council member, every member of staff, and Wayne will work that out, everyone in the public will still have an option to participate electronically. That will not prevent that. And that may be personal preference. That's okay. It may be health issues of an individual or their family we don't know those and we won't query them here in our meeting. So we'll just rely upon that. And the reality is we're going to rely a lot on just people's good sense and goodwill to deal with this until we're kind of at that point to where it's hopefully behind us. So, but with that, unless the council tells me differently right now, I think this week, I don't know, Nicole can confirm, but it's going to be within the next few days. I'm going to sign a letter to continue the no anchor location electronic meeting. And it's, yeah, and that's probable. It sounds like that I will do that again next month, unless the council brings it up. The next time we would probably sit down and study the issue would be more like towards the end of May.
Agreed.
Agreed, but we still have the opportunity and the privilege to come here to the city hall too, because I know it's a lot better internet connection than I've been having recently.
Well, it depends on the part of the meeting. What I've noticed here, and we'll ask staff to work on that some more, there were parts of it that were very clear, you know, and there were other parts that were not. And I even tried using earphones at different points with a couple of different methods, and there were still some problems with that. So we're going to work on those to see if we can get that even better. We'll also see, now that we had 3 of us here, how that came across on our public side with Facebook and a few other things like that, to see if that's working as well. We still have some time to work on that. Okay, more comments.
Yeah.
Councilman Yoon.
Yeah, I think there's no hurry for that, to be honest with you. Yeah, I agree with you 100%.
Yes.
I would-
Now, we wanted to do that here with 3 of us. If more want to come, we'd probably have someone in a office somewhere. I'm having problems with my local internet, so that's why I'm coming here. It's actually more convenient to stay home. There's no travel time. And I can get up between meetings and go have a snack or eat dinner or talk to my wife, and so. But we want to make sure that we meet the needs of the public as far as clearness and of safety with what we do. Councilman Fitisimano, I'm sorry, you acted like you had something you wanted to say.
Sure. I did just want to voice my support to what has been already mentioned in terms of the measured evidence-based approach that's already been mentioned. And I think, as you know, some people are surprised when we talk about COVID-related topics on these meetings, that for someone who works 40 hours, well, 70 hours a week on this exact topic, I don't have a lot to say about it in these meetings. And Mr. Pyle actually hit it on the head in that West Valley City has, and you complimented the staff as well. I work with all 13 local health districts in all 29 counties. And I have to say, not just because I love West Valley, but West Valley staff and city management has maybe one of the most comprehensive knowledge bases and surveillance processes in place. And that's why I don't have to say a lot in here. Actually, Mr. Pyle and his staff have the updates that we get every week. The things that they're putting together are very measured, very evidence-based. And with that, I do also have to say that you're both right, Steve and Dawn. You know, the herd immunity definition is pretty broad, anywhere between 70 and 90%. So you both get an A+ on that. And looking at how the state epidemiology folks are kind of projecting, again, perfect case scenario, as Mr. Pyle had mentioned, if the uptake of the vaccine remains as it is now, if doses increase to where it can meet capacity, and if it really is as effective at producing immunity as it is, a lot of our state epidemiology folks are looking at June-ish as probably that date where that herd immunity might be reached, again, given some leeway. But yes, I second that the approach that's being taken currently, especially as we move from a lot of counties are moving now from high to moderate or from moderate to low transmission risk index. That also impacts, guidelines about how many people are recommended to be able to attend social gatherings and that type of thing. So I second that whole process and fully support city management and staff on the course that they've taken thus far.
And I would second that. This COVID-19 is an example, but what I have found consistently over time is that our staff performs at a very high level of professionalism. And it doesn't matter what the issue is, they dig into it, they research it, they understand it, whether it's economic development, whether it's COVID-19, or any of the many issues that come before us. And I've talked with them a number of times, and it's amazing. They're very prepared. Whatever issue I bring up, they are ready, and they can answer all the hard questions. Well, as hard as I can ask, I guess I should say. So the other thing is, within Utah too, there is a variation. Some of the rural areas where social distancing has been a matter of course because of the small population for many years, have different needs. And we will focus on what's best for West Valley City and our residents who live here in our city. They already do that. So thank you so much. Thank you, Jake, for sharing that information. Any other comments on that? Any council calendar questions? We do remind everyone that the fifth Tuesday, get the right hat on here. We will not be holding a meeting next week because of the fifth Tuesday. We do, does anyone have any comments for potential future agenda items?
I have a couple, Mayor, that came up from the meeting we had with the Healthy West Valley Coalition yesterday. Number one, they talked about the drug take back in April in cooperation with the DEA and the police department. National Guard is also working with that to cooperate between all three of them. And they asked if maybe the coalition would like to help with that in some way. If we could cooperate with the police department and DEA and work, maybe give them some extra volunteers or some extra help and whatever they needed. I know it has to be under the police department for legality reasons, because they're pulling back in prescription medication, and that has to be done with the legalese. So, but maybe if we could look at something there on a future agenda as to how we want to cooperate with the Healthy Coalition. And then also the thing that was brought up with possibly making them if we could explore how we would go about getting them under the city umbrella a little bit more. I know we cooperate with the city continually, but just maybe a little more formalized, those two items.
Okay.
Mainly, they would probably be discussion items rather than full agenda
These
items.
would still be at to be a discussion item under our communications.
And I
Are
like the way our staff is moving the camera now to focus in on us if necessary.
Oh. Yeah. Are those items that you would like to get more information on? I'd like to see a few nod of heads if.
Yes.
Okay. Yeah, I think we're there. So, and so this would be more an assignment staff. I know I got the impression that the Healthy West Valley and that commission issue would be one that we would discuss. The other, I guess so, yeah, not quite as strong, but I still think enough that want to do it that we'll do that. And maybe if you have more particulars on that from what you said, Don, to communicate directly with the staff outside this
Yeah,
meeting.
I think the police department is getting most of those communications because
Okay.
they're the lead agency on something like that.
Any other potential future agenda items? Yes, Councilman Bueller.
Thank you, Mayor. From time to time, including tonight, we have items come up on our agenda for subdivision approval where we in fact take a vote, but the item qualifies with our law and needs to be approved. They have a right to be approved. And as I was thinking about this, I thought that maybe we would approach that differently. We had decided as a council that we still wanted to see those subdivisions come through the council so that we would be aware of them. But maybe instead of having a vote in our regular meeting, we just had them come up with a presentation in our study meeting that this subdivision has met the requirements and is approved or will be approved, and we wanted you to know where it is and see the map and so forth.
So if that's on our agenda, we would not need to take a vote or action. If we took no action or didn't even plan to, it would just go through.
We still have the right to vote against items that come up before us.
Once they get to the point that they have, and we'll ask the city attorney or Wayne if I'm wrong here, but once they get to a certain point and they have a right to be approved, and we have come close, I think, to voting something down, and I was at fault on that when they had a legal right to be approved because they had met all the requirements.
So Ms. Cottle told me at one time that anything that comes before us, we do not have to have a reason for, but we can vote it down. So
and I agree with that.
Good her.
And I agree with that, and that's why I think we have a problem with this particular issue.
I guess one of the ways you could maybe state that, we have a box that we have created and said, if it's zoned this, you can do this in here. And if they do it, we've already approved it.
Right.
It's technically already approved. But if they ask for a variance from that, a different zone, a different development, something that doesn't meet the rules we've put in place, then clearly we would have to vote on that. But if they've met the requirements, we still see it, but we don't technically, I guess, have to vote on it.
Right. So I'm bringing it up here as a future agenda item that we could have some instruction from staff, from our city attorney as to what we can and can't do, and maybe we change our procedure on this.
And the best way of handling that on our agenda so that it's clear to the public as well and so forth. Yeah. Any others? Any council reports?
Hey, Mayor. This
Yes,
is Wade.
sir.
Just going back to the previous item there, because I couldn't see everybody. I was looking at the council shot. So I assume there were 4 or more people that wanted us to bring that back as a procedural description and then discussion for you guys.
Well, let's confirm that. Yes, there's at least, 5
Okay, very good. Thank you.
that I could see. Okay. All right. And certainly, Mr. Pyle and your staff, the attorneys, Ms. Cottle, our recorder, if you have input on that process or recommendations, we would certainly expect you to bring those forward.
Yes, and I think also a reminder of where we've been before, because I remember when it came up, we were kind of told that, hey, you won't see these anymore because if they qualify, then they're just going to be approved. And I remember speaking out that I think we still want to see those and know what's going to be developed. And then it turned into that we're still voting on them. So we just need to be reminded and organized on that, I think.
Okay.
Yep, absolutely. We can do that. And a good reminder and just review of that, I think will make the issue very clear. I don't think will be any, question about what's allowable, what is not, what's a legislative action, what's an administrative action. We just need to review of that. And then you guys actually can, from a procedural standpoint, you council members, pardon me, can decide how you want to handle them. And we certainly can make changes to that. Absolutely.
I
If
agree
you
with,
want.
I agree with Steve Bueller about that. Mhm.
Okay. Very good. If there are no more reports, we have no need for a closed session. So we're done for this meeting. That gives us a little time in between. With that, a motion for ending our meeting.
Move to adjourn.
Without objection, we will stand adjourned. Hearing no objections, we are adjourned unanimously.